As restrictions start to lift, lots of you have had questions about what's life look like outside the front door. I know my mum's asking me, is it safe to do this, that and the other thing? And of course, we haven't got a vaccine. So has anything much changed? Or are we got to be, overly careful, or can we be not careful enough? And some have said to me, do you wash your fruit and veggies in soapy water? Goodness me, do you leave your shoes outside the door? I don't know. So let's get an expert in to talk about all of these things. Professor Sanjaya Senanayake is an infectious diseases specialist and associate professor at the ANU. He joins me now. I put some questions, or asked for responses actually, on my Facebook page, and they've all come in. So I'm just going to read them through, Professor, and you're in the hot seat here. It's a bit like, Who Wants to Be a Millionaire? The first question comes from Grace Morgan, and she asks, how long is the virus in the air after speaking, coughing, sneezing, exhaling when running, for example? She said, I've heard many answers to this. Why shouldn't we be wearing masks in public?
Right. So we still think, and we have thought this for the last few months, and we still think this is the case, that this is spread by droplet transmission predominantly. So when people cough and sneeze, droplets of infection come out of the nose and the mouth, but they fall very quickly, almost immediately, within 1.5 meters of the person who's coughed or sneezed. So that's how we think it spreads. In the laboratory setting, in a journal article in the New England Journal of Medicine, they were able to aerosolize it for up to 3 hours, but that was an experimental setting, not representing what happens in normal life.
Okay, talk to me quickly about masks, though. Why are they being used overseas and not in Australia?
Okay, so we still think the best time for someone to use a mask if they're going outdoors is if they themselves are sick, so they don't cough or sneeze over other people. If everyone were to use a mask, there would be a risk reduction from getting COVID-19, but you'd have to have a lot of COVID in your society or in your community to get that benefit. Now, that's a big issue in some other parts of the world, but not in Australia at the moment.
All right, let's move on. Sonia writes, she says, I'm of the understanding that people shed after the flu vaccine, meaning they are infected but don't know. How safe will a COVID vaccine be if it is fast-tracked?
Okay, so probably two ways of looking at this question. The first one is the person asking, if someone gets the flu vaccine, they then shed flu because they've received the vaccine. Well, it's a dead vaccine, so there's no virus in it. And the COVID vaccines that are being tested on humans at the moment are also dead. So they shouldn't be shedding live coronavirus or SARS-CoV-2. But the other way of looking at the question is, the flu vaccine is now most effective vaccine, so some people can still get flu after getting the flu vaccine, and we're still yet to know how effective the COVID vaccines are going to be.
All right, another question here, and I think this is a good one. Bridget McCaskill says, considering the case in Cairns this week from a passenger who disembarked the Ruby Princess cruise ship 10 weeks ago, how long can the virus incubate to appear so long after what we think was the exposure?
Right, so in terms of the incubation period, the time after you've been infected to the time that you get sick, we've said that this seems to be generally sort of 1 to 2 days, up to 14 days. But there are exceptions. There have been reports of people who've been beyond that 2 weeks. Now, obviously, this is a lot outside that 2 weeks, but in every infection, you do get these outliers, but they are the exceptions, not the rule.
All right, Regan Manny wonders, should we be leaving our shoes at the door and having a wash station at the front door? I've heard this one too. What do you think?
Yeah, so if we have a lot of COVID in our community and you're bringing stuff from outside inside, it probably isn't a bad idea to leave your shoes at the front door and sanitize your hands. Right now in Australia, there isn't much COVID, so it's not so much of an issue. But you have to remember there are some cultures where they recommend taking shoes off when you come into someone's house, just so you don't bring sort of dirty stuff in anyway. So not a bad idea.
All right, Sharon Opitz says, can the virus survive on packaging that comes with an online purchase? Or let's talk about things that you might pick up at the supermarket, fruit and veggie, etc. Or what would you do with those things at home?
So in an experimental setting, the virus has been shown to live on cardboard up to 24 hours and on plastic up to 72 hours. So in theory, if you get a package delivered to you, wrapped in a cardboard box or packaging, it could have virus on it. The risk is very low, but it could be there. And if that is the case, if you want to be 100% certain, you can just wipe down the package with an alcohol wipe or a detergent wipe, or just leave it for 24 hours.
Right, I think this is the most important question. Vulnerable people, people that are older, let's say over the age of 70, we don't have a vaccine, we know that. Nothing much has changed since we went into lockdown, other than we've closed the borders and we've got this virus under some level of control. Would you recommend older Australians still sort of limit their exposure when going out and doing things outside the home?
I would, but you have to balance that with people's mental health, their need to get physical exercise as well. We're in a very good position in Australia at the moment. We're not free of COVID, but we've really got those numbers down. So if people are able to be cautious, exercise social distancing when they're outside, then by all means go outside.
My mum will be happy with that. Thank you, Professor Sanjaya. I'll leave it there. Thanks for your time. You did very well. Excellent.
Thank you so much, Peter.